Good morning. I'm thrilled to be here with all of you, and I'm thrilled that all of you are really the first to hear the findings of our inaugural State of Patient Access. As you listen to the findings today and you'll hear reflections from our panelists, you may come to the same conclusion that I did when I learned about the findings, and that is we have a whole lot of work to do to improve access to care in this country. And as Corey said this morning, the hope is in this room, because I think it's all up to us to make the needed change to improve access to care in the country. My colleagues are joining me this morning to reflect on the findings and to share their own perspectives and lived experience. So we have a lot to cover this morning, and I'm going to first ask my colleagues to very briefly introduce themselves. We'll start with Monique.
Hello, everyone. Can you hear me? Yeah? Okay, great. Hi, everyone. My name is Monique French. I am a senior director at RX for Good, a consulting firm focusing on empowering organizations to help companies put patients first. I'm also a board director at the Center for Black Health and Equity. I've spent my professional public health career in nonprofit, state governments, a Fortune 500 pharmaceutical company, and more. But most importantly, I'm a 2-year lung cancer survivor diagnosed in 2021 who had to learn how to advocate for herself, to have more moments with my husband and 3 boys, where we reside in Indianapolis, Indiana.
Good morning, everyone. My name is Mike Galarraga. I am the Pennsylvania State Representative for Outcare Health, which is an organization that's a national organization that has a directory of healthcare providers that are queer and trans-affirming individuals. I'm also the secretary for the American Art Therapy Association, and I'm an adjunct professor at Drexel University here and at Jefferson University here in Philadelphia.
Hello, I'm Adrianna Nava. I'm currently the president of the National Association of Hispanic Nurses. Our organization is a professional nursing organization that focuses on creating pipelines for increased diversity within the nursing profession. But we're also focused on advocacy for the Latino population and looking at ways that we can increase our advocacy as well. I'm also a research scientist at the National Committee for Quality Assurance, where we develop health performance measures for HEDIS. So that's our quality improvement tool for health insurance plans to ensure that there's accountability. And I'm really interested in this topic of healthcare access and how we can determine best ways and approaches to improve our healthcare system. So looking forward to discussing with my colleagues.
Well, I know many of you are familiar with the PAN Foundation, and Kevin introduced us, but we are a national patient advocacy organization and charitable foundation. We are proud to be celebrating our 20th anniversary this year. We have served as a really important safety net for people who are underinsured to make sure they have access to the treatment they need, and we have long advocated for improved access to care. So today, PAN launches its Center for Patient Research, and the State of Patient Access is one of the center's key initiatives. The Center for Patient Research is dedicated to providing evidence-based insights that convey the challenges that patients face every single day accessing the care they need. The State of Patient Access is one way we can create an agenda, work with the stakeholder community, work with policymakers to find common sense, patient-centric policy solutions to improve access to care. You know, when we started this initiative at the PAN Foundation, our goal was not only to validate and discover the barriers to health care that Americans face, and likely all of us are familiar with, but to really understand the disparities that exist between groups and communities, 2024 is going to be our baseline for the state of patient access. Moving forward, year over year, we're going to be able to hopefully measure progress as we improve access to care. Working with the Harris poll, the PAN surveyed more than 2,500 adults living with chronic conditions this past summer, 2023. And we ensured that the patient population, I know there's a lot of data and small print, but we ensured that the patient population surveyed was diverse so that we would be able to compare findings between groups and communities. So we're going to dive in. Please know that this report you can access online at panfoundation.org, and at the conclusion of the presentation, you'll have a little QR code that will give you quick access to the report. There is a ton of data in this report. Today, we're going to just touch the surface and provide the key highlights for you. Foundational to this initiative, PAN developed our State of Patient Access Scorecard, which aggregates through a rigorous methodology patient responses to questions in 5 categories: overall access to care, relationships with healthcare providers, affordability of prescription medications, access to treatment through healthcare plans, and financial toxicity. Overall, patients rated access to care in this country with a grade C. Who in this audience feels that grade C is good? Yeah, it's not. It's not. We have a lot of work to do. I know, I always use this example, my parents were never happy when I brought C's home from high school and college. I needed to do more work. And unfortunately, and perhaps not surprising, we see that disparities exist. When we analyze data by race and ethnicity, gender identity, generation, people with low income, adults in these communities are giving access to care much lower grades. So we're going to look at each of the dimensions of the scorecard, the first being the overall access to care dimension, which includes questions related to how patients rate their overall access and the quality of care and coverage that they receive from the healthcare system over the last 12 months. It also includes questions about perceptions of the negative impacts that their identity had on their access to care and logistical challenges that they might face. Adults rate their overall access to care as fair at best, giving it a score of C+, which was a 78.8 score. People of color, Gen Z, millennials, patients within the LGBTQIA community are more likely to identify barriers to care. Close to 1 out of every 2 adults reported facing at least one logistical challenge accessing their care. This may be things like inability to pay for their medications, challenges with healthcare plans, difficulty making an appointment with their healthcare provider. Nearly 4 out of 10 adults felt that some aspect of their identity impacted their ability to get the very best possible care. And more than half of all adults reported needing help accessing the care they need. Our next dimension is the relationship with healthcare professionals. This earned a score of B, not too terrible, an 84.2. It includes questions relating to patients' interactions with healthcare professionals, their trust in their providers, and their ability to communicate well with them. The relatively positive assessment of healthcare provider relationships, as you see here, was not universal across the different groups and communities. You see lower scores, for example, with patients who identify as LGBTQIA, or the Gen Z millennial patients, our younger patients. Now, the overall percentage, overwhelming percentage of patients do trust their healthcare professionals. This is not a surprise. We've seen this in other national surveys. However, we see that nearly 1 in 3 did cite issues that prevent effective partnerships and communication with their healthcare professionals. For example, many felt that their healthcare providers simply do not take their concerns seriously, or they may have been critical of their lifestyle habits. While the overall score for the affordability of prescription medications category was not terribly low, rated at B-, overall, we see disparities among groups and different communities. For example, Hispanic patients, patients of color, Native American or Pacific Islanders, and those identifying as LGBTQIA give this category poorer marks. Now, in our research, adults with adult chronic conditions said on average they were taking 4 prescription medications. 1 in 5 said their medications were not affordable. The overwhelming majority of people who reported high out-of-pocket costs took some action. More than 1 out of 2 adults chose not to fill their prescription. More than 1 out of 2 adults chose not to fill their prescription. A third chose to go back to their healthcare provider to get a more affordable treatment. A third chose to ration their treatment. A quarter chose to simply stop taking their medication. And more than 1/3 reported that their physical and mental health suffered as a result of 1 or more of these actions. A disturbing statistic, more than 1 in 10 landed in the emergency room or urgent care facility. Access to treatment through healthcare plans dimension. The worst dimension score of the scorecard, earning an overall D-, 62.8, a D-, and certain patient segments rated this measure even worse. Hispanic and Native American or Pacific Islander patients, the LGBTQIA community, younger patients, individuals with lower incomes, they gave it a failing grade. 1 out of 2 adults reported some sort of logistical challenge accessing the care they need through their healthcare plans. What were these challenges? It's the challenges that we all see every single day and that you heard about this morning: prior authorization, high out-of-pocket costs, medications not being covered, high deductibles. And people are worried. In fact, 3 out of 5 adults are really worried that over the next 5 years, their health care plans are going to be a whole lot more restrictive. And our final dimension is financial toxicity. In this report, we define financial toxicity as the emotional, mental, and physically debilitating financial side effects associated with the treatment of their condition. And overall, patients rated this dimension a C-. But this dimension had the most variation across the different groups and communities. Nearly 1 out of 4 adults said that financial toxicity impacted them a great deal. And for example, Black adults rated their financial toxicity a D. Hispanic adults gave it a failing grade, as did other communities. This slide is disturbing to me. It shows that more than half of adults surveyed couldn't afford unexpected medical expenses of less than $500 over the last 12 months. And across the board on the slide, adults living with chronic conditions are having trouble affording and paying their rent, everyday expenses, utilities, putting food on their table, and they're having trouble affording their deductibles and out-of-pocket costs for prescription medications. So, I don't mean to depress everyone. We have a lot of work to do, but now we're going to drill down into some of our communities. First being patients of color. People of color rated access to care in the US with a C score. Just as a reminder, all adults rated this dimension with a C+. Compared with white patients, patients of color reported a much higher need for help accessing the care they need. They were significantly less able to afford an unexpected medical bill, and they faced more logistical challenges accessing the care they needed. Our findings show that this community, LGBTQIA, is more likely to rate their health care as poor compared with other patients. In this dimension, they gave it a C-, again, compared with C+ for adults. However, when we look across all 5 dimensions of our scorecard, they're rating access to care in the United States with a D, compared with C for all patients. 7 out of 10 are reporting challenges with affording unexpected medical bills. 7 out of 10 report having a mental health condition. 7 out of 10 report having a mental health condition. That is a stunning statistic. Females rate the overall access to care in the country with a C+, but they have challenges getting an accurate diagnosis. On average, they're reporting it's taking 4 years or so to get an accurate diagnosis, where it's a little bit more than 2 years for men. And their financial toxicity, they report, is much higher than we see in men. Patients with lower incomes, this is defined as $50,000 annual earnings or less. This group rated overall access to care also with a C. More than half of people with lower incomes rated their health as poor or fair, compared with 35% of higher earning patients. 8 out of 10 patients with lower incomes said they could not afford an unexpected medical bill of $500 or less. And people of different generations, they rated overall access to care with a C or C-. But here too, when we look at all 5 dimensions, they gave access to care in this country a grade of D+, compared with C for all patients. Across the board by age, 4 out of 7 out of 10 patients are reporting challenges with health plans, but it seems like this is impacting our younger individuals at a greater rate. At least half of our younger patients reported having a mental health condition. So, a lot of data, a lot of information just thrown at you. What does it all mean? First and foremost, patients with chronic conditions are not rating access to care in the United States with high marks. They're struggling. Social drivers of health impact their ability to access the care they need. And the challenges accessing care are particularly prevalent when we look at patients of color and the LGBTQIA community. At PAN, these findings validate the need for us to continue to advocate for common sense, patient-centric policy solutions that's going to move the needle in terms of access to care. And we're going to do all we can to educate patients and healthcare providers on all of these issues. And I think that is true, and that should be everyone's agenda in this room here today. So, we're going to turn now to our panel discussion. My first question to all of you is, what stood out to you in these findings? And there were a lot of findings. What stood out, and how are the disparities that we highlighted consistent with your experience, both as a healthcare professional or a patient? Monique, we'll start with you.
Sure, I'll go. What stood out to me was 38% of individuals reported taking a year to 3 years for an accurate diagnosis. That hit home to me because it took me 2 years of wrong diagnosis in order to be diagnosed with lung cancer. So I was diagnosed with asthma, bronchitis, I went to the ER, I was diagnosed with pneumonia, and so it creates a lot of frustration within that patient population when you're not able to get an accurate diagnosis.
Yeah, and what stood out to me was when we look at the overall scorecard, right? Like that overall grading goes down when you look at interpersonal relationships, like within patient and healthcare providers, and access to medications and financial toxicity. So a lot of it, I think, lends to the education piece, where a lot of individuals, patients primarily, don't have access to that education piece.
I think for me, what stood out as well was looking at how important addressing the social determinants of health is, where individuals without access also have, going back home, they have issues with food insecurity, transportation issues, housing issues, and a lot of times in healthcare, as providers, we're really focused on treating the patient and their health at that moment, but then everyone's going back home, and then they still have to deal with paying their bills, they still have to deal with sometimes being in employers that aren't flexible with schedules and added stress for their daily life, and we're seeing it here with the report card, how patients feel that even though I have access through insurance, it's not enough, and we need better ways in the healthcare system to be able to integrate their daily lives and their realities into what their healthcare needs are, going forward into the future. And I think specifically what was interesting for me was about the millennials and how they're rating healthcare access in general a little bit lower than other generations. And I was trying to reflect, like, why is this happening? And also being a millennial, but a lot of times in healthcare, we don't see a lot of innovation in the way we deliver care. And yet we have a generation that's grown up with technology, and yet when they get to the healthcare system, it's not keeping pace with the changes that they are used to. So now they expect to communicate with the healthcare provider via text message or maybe online and have, more accessibility that way, but our healthcare system isn't set up that way, and there isn't really a way to kind of shift a little bit faster for us to meet the needs of younger generations.
So I wasn't very surprised with the disparities that we saw in the report, but I think some of the low grades really shocked me because they were just not good. And I'm wondering, were any of you surprised by the scores that you saw in the different communities?
No, it's not a surprise. That's what we're facing, especially patient advocacy organizations. You hear it on day-to-day interactions with patients. It's not surprising. This report is bringing light to what we know and what we commonly hear from anecdotal conversations we're having with community members. And so I'm happy that the report is highlighting what is actual and how patients are feeling as it pertains to access.
Michael or Adrianna, any surprises?
I'd agree. As a therapist myself, I see individuals for mental health care needs day in and day out, and that's a big point of frustration for many patients, like coming into that therapeutic sterile environment, right? And then they go home and they're like, well, what do I do? Like, how do I afford medication? How do I afford these options that I've just talked through in therapy? Part of it is trying to figure out how do we educate them on those resources.
Yeah, and I think even for the Latino community, rating it an F, I think there's some things that maybe were not captured for, like, maybe their inaccessibility to, tools that are in their language, potentially. Also the immigrant status, a lot of times can be a barrier for families feeling comfortable or welcomed into the healthcare system. So that might be lending, a lower score than other communities that have reported lower scores as well.
Speaking of lower scores, the dimension relating to access to care through health plans was extraordinarily low. And I'm wondering, Monique, if you have thoughts in terms of why that is.
I think there's several factors. I mean, even as a millennial, it makes me think of my experience. But, we can start with insurance literacy. How many of us really understand our insurance plans? Many of us in the room, we understand it better, but when we're talking to an everyday patient, they do not know what they're signing up for. They're looking at it against their budget on what they can afford, even if it's offered to them through their employer. So those are the realities that, especially people of color, face when we're thinking about that and what's contributing to that low score. In addition to affordability, administrative hurdles, and then my experience of an HCP prescribing you a certain medication or treatment, and then you getting denied. My oncologist and I had a long, lengthy conversation about what was next for me. After surgery, it was radiation and chemotherapy. Radiation was approved, chemotherapy was not approved. And so we had to sit and have conversation about what percentage of my survival rate was gonna be dropped because I didn't have that additional chemotherapy. That is a hard conversation to have. Like, are you gonna go out of pocket thousands and thousands of dollars for chemotherapy? And a lot of communities are looking at that and thinking about that. They're making these decisions based on how I'm gonna live for today versus how I'm gonna live for tomorrow.
You mentioned health literacy, and we didn't share the findings, but there is a section in the report about this. We asked specific questions around health literacy, and you're absolutely right. Adults find their plans awfully confusing, difficult to understand. We even had a question around their knowledge around things like copay accumulators and maximizers and AFPs, and very few adults with chronic conditions were familiar with those terms, which, again, not terribly surprising. Let's turn our focus on social drivers of health. And Michael, I'm wondering if you believe these conversations are happening, and if not, where should they be happening?
Yeah, I don't think that they are happening as frequently as they should be happening. I remember when we were discussing just the overall report and findings, I had brought up just a personal experience of somebody that I know who had a neurological disorder that they're living with, and they went into the room and they thankfully were approached by their physician and talked about like the financial constraints of taking this medication that was going to cost about $2,000 a month. And for this person, they ended up being on FMLA, and then their job laid them off throughout this time that they weren't able to work, and so they didn't have access to pay for that medication every month thereafter. And so I don't think it's happening as frequently as it should. Like that was something that happened recently this past summer, and that's just one case. But think about the millions of patients that are going into doctors' offices, right, just today. Like how many of those doctors, how many of those like case managers in that setting are having these conversations and providing effective resources when those individuals leave that office today.
And I think that's part of the challenge, because it's one thing to have the conversation, it's another to have the resources or to know what to do when issues are identified and that individual needs the support, whether it's transportation or whatever it might be.
Yeah, and like what changes happen over time, you know? What changes happen over a year when a person is on this leave but may not necessarily have work at the end of that tunnel.
And Amy, if I could jump in here.
Absolutely.
So from a systems perspective, a lot of what we've been doing is trying to bring in accountability through measurement. So there's been a big push of creating quality measures that address the social determinants of health. So making sure that individuals are screened for inadequate food, housing, or transportation. But then there's that second piece, that is there an intervention or follow-up tied to that screening. So we're doing a lot of work from like the systems perspective, but it sounds like we need to do a little bit more work with our providers to making sure that they're aware of the screening tools that are available, as well as the linkages between how they report and document that information within EHRs, for example.
Yeah.
So Adrianna, I'm going to ask you a big question. Where do you think we have the biggest opportunity to improve access to care?
That is a big question, so I'm going to focus on the little piece that I am really aware of, is health insurance access, and especially as it pertains to our Latino community. Even after the passage of the Affordable Care Act, the Latino population still has a good proportion that doesn't have access to care through insurance. So making sure that if they're in states that haven't expanded Medicaid, we do a lot of advocacy in those states in order to make sure we teach our providers the importance of that legislation in particular, but also that it benefits our Latino community and really everyone in the larger state and society, because they're gaining access to resources and not waiting to prolong that access that could lead to more costly conditions later on. But also, you know, making sure that we notice that there was about 48% of individuals that notice that barriers or challenges are preventing access. And one of the things that I would love to see is that for us to be able to, you know, have insurance enrollment be a little bit more automatic. Right now, to go into Medicaid or even your own private insurance, you have to go through a lot of options and pick your provider, and a lot of that stuff could be a little bit better automated, especially since we know where providers are and who have the availability to take on patients, instead of relying on our patients to do a lot of that legwork up front. So that would be kind of like my magic wand wish list for us to see to improve access to care, at least starting with having insurance coverage access.
Yeah, that need to opt in is important. We heard it this morning from Corey Ford when he was speaking about the smoothing program, or the Medicare prescription payment plan, or MP3, M3P, whatever you want to call it. The challenge with that is that individuals are going to have to opt into that program. It's completely voluntary. So you just talked about having your magic wand to improve access to care. I always like to, when I moderate panels, ask our panelists, if you had that magic wand and you could change one thing in the healthcare system to improve access to care, what would that be?
I can start. I think for me, it would be prior authorization. The reason why I say that is because patients spend a lot of time building trust with their healthcare provider, and for them to come into a decision that they thoughtfully had a conversation about, reviewed all of the side effects, and for only them to come back and have that denial because it wasn't approved, or even a delayed wait 72 to 7 days to get approval on that, sometimes that's too late for critical decisions or chronic diseases. So for me, it would be prior authorization.
Yeah, and on a similar note, I would say high deductibles, right? Those higher deductibles end up being a driving force that drives patients away from seeking and accessing their own health care. You think about like the education that's around like deductibles. Most people don't necessarily understand like when a co-insurance hits, or like the split between in-network and out-of-network, depending on the provider or the service that they're needing, even within the same office sometimes.
And I'll stick to my opt-in, but I would love also for us to reinvest in the primary care public health system, because I think that would improve access to a lot of individuals right off the bat. So.
Great. So we heard about deductibles, we heard about prior authorization. These are issues that I know all of us in this room are concerned about. We hear it every day from the patients that we serve at the PAN Foundation. We hear it from members of our Patient and Family Advisory Council. These were key issues that were discussed when we brought our PAN advocates to Washington, D.C. last year to meet with their elected officials. So I think we have a lot of work to do. I'm looking forward to the $2,000 cap that will go into effect January 1st for Medicare Part D beneficiaries. I'd love to see it extended to all individuals. I think that would be a great thing. I'm not sure that's going to happen anytime soon, but I think all Americans deserve their out-of-pocket costs to be lowered. And then the other thing that I might add is that we focus on prescription medications, we focus on healthcare plans. Individuals living with chronic conditions have all kinds of costs that they have to worry about to afford their treatment. And as a nation, I think we really do need to think about the total cost of care that patients face, and not look at things in such a siloed fashion, because prescription medications is really just one piece of a big puzzle. I'd love to turn it over to the audience. I know you may have questions, but just a few minutes before we close, to see if any of you would like to share what one thing you would do with your magic wand to improve access to care in the country. Who's brave and wants to share?
Check, check. Oh, just talking to it. Okay, great, thanks. Hi, my name is Layla Vance Mason. I'm with Amgen Rare Disease. And working in rare disease, one of the things that I think if I had a magic wand is if every disease state had a comprehensive care model. Because things like, we've had the physician part of it, we've had dental part of it, we have social work as part of it, and I feel like when there's these communities, rare disease have communities sometimes that can surround sound patients, and when there's advocacy involved that really build that type of model, and if that could be applied to broader disease states, that's really where the golden ticket is, right? Because that comprehensive care model really helps everybody in totality.
Thank you for that. Other ideas?
Check. Hi, Amy. Thanks for a good conversation. This is Usha Roy, Patient Support Services at Azurity Pharmaceuticals. If I had a magic wand, and I think, Amy, you may know what I'm going to say, I'd like to make sure that every patient is informed about what they can or cannot access, because I believe that an informed patient is an engaged patient, and an engaged patient is an empowered patient. To begin with, I think just to begin with, that's what I would like.
Thank you. Other ideas? Any questions? Oh, we have one.
Jonathan James from Hope Charities. Wonderful presentation, thank you. Just magic wand for me would just be that there was no gaps. This is all we've been addressing really this week already, but and you spoke to it very clearly. But when I see the presentations and the data, this is evident throughout all of, especially in patient advocacy, but also throughout all the PAP programs and services, that we're all trying to help close those gaps. But if there was a way to, help the people, sometimes the people who are in the most vulnerable state are oftentimes the ones that have the highest problems, if you will, and the solutions seem to not always trickle down to the people who need it the most. And so I believe that starts with education, as you mentioned earlier. So thank you so much for the presentation. Love to close those gaps however we can.
Thank you.
Hello, I'm Tiffany Crisostomo from the Commonwealth Healthcare Corporation. A magic wand that I would like to see is really a holistic approach. And it's not just about the medication, it's not just about copays, but how do we provide resources to patients in terms of lodging and transportation, especially for those who are vulnerable. So, and in areas that these resources are not available. Mm-hmm. So just branching out to other close by resources. Thank you.
It's really a focus on the social drivers of health. Yeah.
First, thank you so much for the wonderful discussion. My question is for anybody up on the panel who wants to answer it. Everyone's taken my magic wands, so I'm going to ask a question. For everyone sitting up there, we have seen, and there's been awareness of these issues, social determinants of health, issues in access, time and time again over the years. We've all sat at the table asking questions. How do we fix this? How do we fix this? What do you feel our next steps are in order to take this from the table into the communities and make a real change?
I can start. I think we have to meet patients where they are. So many times we are coming up with solutions and ideas at the table and they're not there, or we're not going to them. And they can give us so many different insights and ideas that we may not think of in our nice, pretty offices and corporate tables. Sometimes we have to go out to the communities, engage them, and listen to what are their needs, what are their sayings, because a lot of reports tell us, and we'll give it up into a nice executive summary and overview, but the tangible action items are with the patients that we serve, and that's where we need to get the information from.
One of the nice things that we did where I work at NCQA, we're working on new measures to look at the disability population. And one of the things that we are doing differently is including advocacy organizations who are the experts in that work to join us along on that journey and that work stream that we're creating. Because we're not trying to come off like we know everything, we're the experts, when there's organizations who have been doing the work for years. And really just honoring that expertise and making sure that they're included in the work that we're doing. And I encourage other organizations that are doing something similar to have that open door and pull up organizations who have been, leading the way.
And I was going to say, I know Adrianna, you had mentioned like the age differential, right? And like that factor on the scorecard. And I think about how like as younger populations become older, right? They're just living in a different world than some of the older individuals that we find in the room today. And so really trying to navigate how do we get them that information faster? Because time's not slowing down.
Yeah, we mentioned patient advocacy organizations, and I know Corey focused a lot on working with patient groups this morning. We're all here ready to partner and work together to better serve the people that we want to help, who need our help. I know at the PAN Foundation, we rely on the members of our Patient and Family Advisory Council. We have Michael Riota, who's one of our members here with us today. We look forward to building our ambassador program later this year, where we're going to be collaborating with more individuals across the nation. And when we come to conferences like this, we make sure that we have that patient perspective and that we have patients at the table, people at the table, so that their perspectives are heard. Well, great conversation. I want to thank you all today for being the first to hear the findings of our State of Patient Access Initiative, learning more about the Center for Patient Research. As a reminder, here is our QR code that will bring you right to the report. And I would just say, let's all mobilize even more to work together to find those policy solutions, to advocate for what patients need to improve their access to care. Let's all work together to educate, to improve health literacy in this nation, not only amongst patients, but healthcare providers. Please join me in thanking Adrianna, Monique, and Michael.